Welcome everybody to our advocacy webinar. We plan to go about an hour here, and we're going to start off with a few housekeeping options. So what we're going to do today is take a look at this agenda, talk about our goals and some housekeeping, tell you a little bit more about DDH 2022. I'm going to run through our top 5 disability public policy priorities. And then we're going to have a number of self-advocate guest speakers. The first presentation will be about researching your issues. The second, engaging in local community politics and councils. And the third is how to tell your story and use social media to get the services that you need. To begin with, I'd like to give an audio description of myself, and I'd ask that speakers afterwards likewise add in an audio description of themselves. I'm a white male. I am wearing a white shirt with a blue tie. I've got a dark and quickly graying beard, and I'm sitting in kind of a darkened room here. Other housekeeping items: if you would like ASL interpretation, you should pin the video of the interpreter to the top of your screen so that they stay right where they are. To do that, you'll go over the interpreter's window, hover over the window and click on it, and you should see pin, and you'll click pin and it'll stay right where it's at. If you would like closed captioning, down at the bottom of your Zoom window is a CC button. You'll click on that CC button and you'll see a caret. So it's a little up arrow. You click on that and you'll get a couple options. And then you can either view the whole transcript or change the subtitle settings. If you have questions for us today, there's a Q&A function down at the bottom. It looks like it's about the middle button. That'll give us an opportunity to check those out. And should we have time, we can answer as many of those as possible. After the webinar, a couple ways to stay connected with us. You can head over to our website, tndisability.org, to get materials that we're going to talk about in this webinar. You can check out the recording or the transcript of this webinar, and you can join in on some other Disability Day on the Hill plans. We have a whole tab there. You can check out what's going on with the program this year. DDH this year is all about teamwork. When we talk about teamwork, we're really talking about the power of many voices. The power of many voices to point out when systems, policies, and programs don't work, and try to create a Tennessee where systems, policies, and programs do work. That's the power of our team to get this work done, teamwork. So thank you for RSVPing over on our website. You'll hear about us soon, about joining local teams and going with your Facebook group. Once you've gotten with your teams, you'll have the option to talk about things that are relevant to everybody in the team and sort of plan to meet with elected officials, which we will arrange later on. You can also get updates sent directly to your phone, the marvel of modern technology. If you text teamwork, capital T, capital W, to 72690, you'll get those handy little updates right on your phone. And then given how DDH is kind of being kicked off today with our advocacy webinar, and is continuing through the teams, through the Facebook groups, and through meetings with elected officials, we're going to cap it all off with Disability Advocacy Day, and that'll be March 11th, 2022. And legislators, community members, all of us here at Tennessee Disability Coalition, we're all going to be wearing our Coalition Blue, our Teamwork Tennessee shirts, and then all across the state, a lot of icons of our state: the Bass Pro Pyramid in Memphis, State Capitol, Nissan Stadium, Tennessee Aquarium, University of Tennessee Neyland Stadium. They'll all be lighting up Coalition Blue in honor of Disability Advocacy Day. So before I get to this part, I just want to talk a little bit about the Tennessee Disability Coalition. We are an organization of over 40 advocacy groups that all work to create a society that values, includes, and supports people with disabilities. We have a number of different programs. We have the public policy program, which we'll be talking about today. We have programs called Brain Links, Benefits to Work, Family Voices, the Southeast ADA Center, and then we have a small grants program. I'm going to begin by going a little bit in depth about our top 5 policy priorities this year. So some things to know right off the bat are that the session started just last week, or 2 weeks ago on Tuesday. This early part is full of a lot of formalities. They're just starting to get into redistricting now, so So as they kind of wrap that up, we'll really start seeing the General Assembly session take off. And there'll be a few things that we'll be watching really closely this year. Public school funding reform, COVID safety protocols, policies, and protections for people with disabilities, universal changing tables, Alzheimer's, respite, and telehealth insurance. Those latter three, the universal changing tables, Alzheimer's respite bill, and telehealth insurance, those are all actual pieces of legislation that we've already seen today. So I'll go a little bit more in depth about those. Other things to know about the session this year: it's the second year of a 2-year session, which means that bills that did not fail in committee last year, and of which the sponsor would like to continue on this year, will carry over from last year to this year. So universal changing tables is an example of that. A couple dates to keep in mind. January 31st is the governor's State of the State address. It's his last of his first term. So there he'll lay out his legislative priorities, budget priorities, and what we hope is some information about public school funding. So we really get insight to what the governor's thinking and which direction we think the General Assembly is going to go this year based on that speech. So January 31st, State of the State. Early February will be the bill filing deadline. That means that no more bills after the deadline can be introduced, that everything is on the table at that point. So we don't know exactly what day that's going to be, but that'll be probably within the first 2 weeks of February, and then we'll know what we're working with for the whole session. So a couple things we already know now is that early on, one of the big priorities is going to be public school funding reform. So they're looking at replacing the basic education plan, or we call it the BEP, with a weighted funding formula. So a weighted funding formula looks at funding, and it is student-centric. So it takes students and looks at what their needs are, and it can account for the increased cost of diverse needs of an entire student body, and that includes kids with disabilities. So they'll say we're going to fund student A at this amount, and then we may add weights based on whether or not, say, they live in a rural area or they live in an area of concentrated poverty, because we know that it takes more money to meet the needs of those students. The old system was called a resource-based system, and Tennessee is one of only 6 states that continues to use this type of system. So it's a good thing that we're moving away from this. A lot of the country already has resource-based funds, strictly based on staff to student ratios and attendance. So say a 4th grade class has 100 students, and the BEP says that the ratio of teacher to student needs to be 1 teacher for every 25 students. So we'd add it up, we'd say 25, 50, 75, 100. We need 4 teachers. The BEP only gives you enough for 4 teachers. So it doesn't account at all for the students in that class, the needs of the students in those classes, the makeup of the school as a whole. So it really is inadequate to meet the needs of a lot of students. So this is good. We like that we're headed towards a weighted funding formula. This fall, Commissioner Schwinn and Governor Bill Lee kicked off a stakeholder engagement tour. They stopped at 9 town halls around the state. They convened 18 subcommittees. Are the inimitable Carol Westlake, our executive director, she sat on the subcommittee for students with disabilities and gifted students, and was really able to give us a voice to be advocating for those students' needs. So the last subcommittee meeting wrapped up today, and then we're expecting that by the State of the State address on January 31st, we should have some sort of legislative text with a proposal for what the state wants to do as far as public school funding goes. They have released a draft framework in which there are 4 different types of funding that'll be used. There's the base funding, which is similar to a resource-based funding, but still necessary to make sure that schools are able to pay for their basics, like teacher salaries, nurses, counselors, RTI2 interventionists, district-specific needs. So if a district is a very rural district and it needs more buses, they might pay for the specific needs of that district for more buses. Technology, and then coordinated school health programs. And if you can picture a pyramid, this is how they're kind of proposing it. The base is the biggest chunk of money. On top of that are the weights. And the 4 things they've decided to weight this year with the new system are poverty and concentrated poverty, students living in rural areas, students with special needs, and students who go to charter schools. Next up on the pyramid is direct funding, and that could go for things like career and technical education programs. So there's a school in town that has a bank in their school building, and it's one of their career and technical education programs. They're going to get money so that they can operate this bank. Not every school needs bank money, but they'll get direct funding for something like this. And then outcomes. They haven't released the specifics about what those outcomes are. They make some vague references to achievement gaps, but we'll see what happens. We hope that it's rewarding schools for improving their student achievement as opposed to punishing them for the reverse. So things we don't know yet. We don't know exactly the degree of weights. We don't know how big each weight will be. So we're waiting on that. And we're waiting to see whether or not just generally the pie is bigger. If you're going to start addressing diverse sets of needs that we already acknowledge could sometimes be more expensive, we're probably going to need a bigger pot of money to work with. So we don't know whether or not, one, they'll increase the amount of funding to schools, and two, to what degree. So still a lot to be learned. Keep an eye out for the end of January for this one. COVID stuff. So in the fall, the General Assembly called a special session to talk all things COVID, and ultimately ended up rolling a bunch of different agenda items, priorities into what's called an omnibus bill. So it's all these different things related to COVID in one bill. It's understood that there was some pushback from that. There are some lawsuits pending on that. So it's not quite working out how everybody thought it would in the General Assembly. So there's already a bunch of new legislation about this. So one of them is vouchers for children who go to schools that implement a mask mandate. The General Assembly was hoping to remove some local authorities when it comes to public health decision making. There's a bill about vaccine rules, in that you have to recognize moral or religious opposition to a mandated vaccine. There's another bill that requires businesses to recognize natural immunity on par with vaccine immunity. There's a bill that removes some of the power of licensing boards to sanction or give directives to its members. So like there's a licensing board for physicians, and they don't want this licensing board to have the opportunity to, say, punish a physician based on some COVID decision making. They want to put in some exceptions to the previous rules that they all made when it comes to masking, vaccines, stuff like that. And then there are bills that would like to remove facilities that get money from the Centers for Medicaid and Medicaid, CMS. They would like those, because they're mostly healthcare organizations, to be able to kind of implement their own COVID policies. We have a couple goals here at TDC. We would like to see masks be permitted in congregate settings like group homes, and to increase some school options for mitigating some of the most negative effects of COVID. There's also a pending lawsuit in the Sixth Circuit right now that is currently allowing districts in the state to implement a mask mandate. We'll have to see what happens with that one. So now we're on to the actual bills. This one is universal changing tables. And a universal changing table is an adult size changing table in a single occupancy bathroom. So if you can picture like a baby changing table in, say, like a bathroom stall, this is similar, except it is universal size. It could fit a baby, it could fit an adult. It's universal design, it's a great idea. And then it's mechanized. It has a lift and a lift off the ground, and it's in single use or single occupancy stall. So just one person in at a time. And this is important because it allows families who may have this need the freedom to go about town. So if you were to go to the mall and you would need to do some changing, and this didn't exist, your options are either, change your loved one on the floor of a bathroom, or you go home. And those aren't great options. So this is a really good bill. It's a carryover from last year. It's sponsored by Doggett and Watson. Last year, it had a really large fiscal note, meaning that the state determined it would cost a lot of money. And so they sent it to summer study to see if they could bring that fiscal note number down. So we're expecting to see some changes to the bill text, to the mechanism that gets buildings to install these in order to reduce that fiscal note. This is another really good bill. This is from the Alzheimer's Association of Tennessee. It's a respite bill. and it establishes a pilot program to provide respite to caregivers of people living with Alzheimer's and or dementia. And that covers a lot of people in this state, 357,000 caregivers that provide over 500,000 hours of care. And respite is very important to that. So what is respite? Respite is the opportunity to have a qualified individual come in and provide care to your loved one while you took care of some errands, went out to dinner, or just took some time to yourself, because family caregiving and caregiving in general is a lot of work, and it has a physical, emotional, financial toll on the folks that are doing this great work day in and day out. So being able to provide them respite helps kind of maintain those caregivers as well. They're going to be prioritizing folks on the options waiting list, which helps those folks get services that they're not able to get right now. And it begins to open the door to addressing a larger problem in the state when it comes to respite, not just for adults with Alzheimer's or dementia, but kids with disabilities, adult children with disabilities, where this service really is either not available or difficult to obtain. And then it begins to help us address the caregiving workforce, which has long been in crisis in this state. So by opening the door with this respite bill, we're able to kind of begin to have that conversation. And then this one is telehealth insurance. It does not have a Senate sponsor yet. It's sponsored by Representative Hawk in the House of Representatives. So this bill extends some flexibilities for telehealth services that were developed during the pandemic. So it includes who can provide telehealth, like what kind of care providers, and what kind of services can be provided via telehealth. And this has been really important, especially in rural areas. We've had a lot of hospital closures here. We have kind of a threadbare safety net or net of care providers that makes it difficult for people who live in like a rural area to see a specialist. So instead of driving a couple hours, they can hop on telehealth, talk with this person, and still receive care. One of the big things here is it requires insurance companies to cover that care. It's called parity. It requires that in-person care be treated the same as telehealth in the eyes of an insurance company. So these are coverable services. The previous law set this clause to expire in April 2022. So this bill right here would extend that indefinitely. So this is an excellent bill. So I see a couple questions here. Nope, just looks like some support for these bills. Love it. Anybody who has more questions about this, feel free to ask, and I'll try to keep an eye out in the Q&A section. With that, I would like to introduce our first self-advocate, or should I say self-advocates. First is Mr. Mike Blackburn. He is from Nashville, Tennessee. He's an individual with Down syndrome in the Next Step program at Vanderbilt University. He's got some passions. He loves having fun, working hard, and spreading joy to friends and family. And his favorite activities are watching the Preds play, going bowling, drinking milkshakes, and having fun with his best buddy, Justin. Love those things. That's great. He'll be joining us through the miracle of modern technology. Elijah will also be joining us, but it's not quite so miraculous. It is technology. He is from Atlanta, Georgia. He's studying special education at Vanderbilt. His passions are swimming and serving young children with neurodevelopmental disabilities. His favorite activities are club swimming, making friends through best buddies, and a couple more that I can't see because my Zoom bar is in the way. So with that, I am going to pass it over to Elijah. Elijah, if you would just give us a quick audio description of yourself, and I will pass over sharing capabilities.
Awesome. Thank you so much, Jeff. My name is Elijah Simon. Thank you again for having me. Just to give an audio description, I am a Black male. I'm wearing a pretty colorful striped shirt. I have circular turquoise, turtle, I guess, designed circular glasses. I have short hair and a bit of a mustache. But yeah, to start off the presentation for the day, let me go ahead and share. There we go. So hello, everyone. Again, I'm Elijah Simon, and I made this project with my friend Mike, or Big Mike, I may refer to him later, basically on how to access information regarding disability advocacy and Tennessee policies throughout the General Assembly website. Before beginning, on behalf of Mike, who is unfortunately unable to make it at this time, just want to say thank you to Jeff for allowing us to sort of share our passions in regards to disability advocacy. So to go ahead and get started, again, those are introductions. I'm gonna go ahead and skip through this. So to begin things, Mike just wanted to make sure that everyone knew some of the favorite things he likes to do on a daily basis, some that did not make the biography.
I like watching a movie. I like having a picture night to organize, get ice cream, just getting lunch and dinner, simple and park and bowling and having sleepover and trying to go to Predators game. Oh, that's my favorite things to do.
So a big Predators fan, he definitely loves to let everyone know. But moving forward, we're getting to the meat of the project, of course, the General Assembly website. Basically, the website, you can visit at www.capitol.tn.gov. And you can basically browse through current bills and basically track them as they are making their way through legislation. Once you go to the webpage, the home page, if you look to the top left corner, you'll see a tab that says legislation. Once clicking that, it'll open up a few more options to where you can search bills through an index or through various subjects. So this is important because the General Assembly website holds a lot of the policies that we are adhering to right now, especially in response to COVID-19 and making sure that everyone's safe. So here's just a message from Mike about how he feels about current COVID-19 policies.
It's always, or sometimes it's difficult because COVID is not just because that, it's just wanting to sit down and talk to people and that.
Yeah, so as you can see, Mike is very, very, very social. He loves to have fun and talk to other people. So COVID guidelines have definitely put in a damper on his, friend-making abilities, but he's still very happy. And back to COVID, if you visit the General Assembly website to get some updates on certain policies regarding COVID-19 protocols in schools around Tennessee, you can get live updates as well as look at the past bills that were introduced in regards to COVID-19 or other, elements of our past. Moving forward, we asked Mike what he was involved in throughout the year, aside from Best Buddies and Special Olympics, and he gave us a few different activities.
I'm involved in Best Buddies, and when I was in high school year, I am involved in Young Life, and this year I'm involved in all the
Yeah, so involved in a lot of different programs, but something that the video did not capture, unfortunately, was Mike. He shared with us that even though he is very grateful to go to Vanderbilt and be a part of Best Buddies and Next Steps, he does notice that there are certain discrepancies in the clubs that he's welcome in. He definitely does not he wouldn't consider all clubs and all organizations on campus to be inclusive. And of course, that is a big issue for us and something that we want to change moving forward.
involved in.
So regarding that, with the General Assembly website even posts information on combating discriminatory acts against individuals with disabilities. So in trying to push for a more inclusive future, the General Assembly makes sure to list all the bills that regard, discriminatory acts. And for example, this one bill, even though it has more of a medical foundation, prohibits the discriminatory selection of organ donors based on disability. That is something that individuals with disabilities in the past have unfortunately have had to deal with. Moving forward, another question we asked Mike, this one was a bit of a harder question, just about what's it like having Down syndrome? What's it been like for him? What was it like as a kid? And what is it like today?
So, actually, I got 3 siblings, and they're all sometimes it's so hard to deal with family. Because sometimes I wanted to get out of the house during childhood, and I see my sister and daughter go to places, go to parties, but I feel so lonely and isolated some days.
Yeah, so I know it was a bit hard to hear, but Mike basically tells us that throughout his childhood, he definitely had a happy, healthy childhood. But there were a lot of times where he had to watch his neurotypical siblings basically go out, experience the world, pretty much have access to all programs and different services that he never really had access to. And even though most people didn't really ask him how he felt about it, he definitely felt it within himself, and it brought about a lot of loneliness. And unfortunately, he still feels a bit excluded from a lot of programs and other things in public today, which segues really well to the next point, which is finding ways to honor and celebrate individuals with disabilities. So one of my favorite things about the General Assembly website is they'll actually list the new days, the awareness days or awareness months for certain disabilities or other groups and communities. So for example, if you go to the website and type in awareness, you'll see a bunch of bills are in the process of being passed or have already been passed through legislation. For example, the Williamson Syndrome Awareness Month, that'll be in May. And for another example, World Down Syndrome Day, that's in March. And of course, Down Syndrome Month is in October, Down Syndrome Awareness Month. So, we talk about these months and these days a lot, we bring it up and the day, goes by. And that's it for us, for many of us. But for Mike, certain days like these where he really feels honored, where he really feels celebrated, these really, really mean a lot to him. So I just find it really, really awesome that the General Assembly website lists all of this as well. And to wrap up, just a quick overview and summary again. This is the General Assembly website of Tennessee. You get to see current bills as well as bills that have been passed in the past. Also, you can locate nearby legislators. You can learn about current issues and certain policies. You can learn about which legislators are advocating for certain policies. You can even get in contact with certain legislators and track certain bills. Thank you.
And thank you, Elijah. We have a couple of minutes here. If anybody has any questions for Elijah, go ahead and type them into the Q&A box down at the bottom. Again, that's down kind of along your toolbar at the bottom under your video window. One question that we got last time that I thought was a really good question for Elijah is, Elijah, how did you choose special ed to study in school, and what makes you such a big advocate for folks with disabilities?
Yeah, so awesome question. I love that question as well. I'm an Army kid. My dad is a veteran. He served 20 years. He himself, he is disabled. And I thought, being with my dad all the time and seeing how others treated him, how family members even uh, change their views on him, how they speak about him, how they speak to him. It made me really, really uncomfortable. And especially with living with my dad and, assisting him in a lot of the anxieties that he feels throughout the day. Throughout high school, whenever I would volunteer with certain organizations such as Special Olympics, I noticed a lot of similarities between certain characteristics with my father and the awesome children I would work with, specifically with anxiety. I know that's a really, really big thing in disability and something that many of us abled or disabled deal with on a daily basis. And really just working with kids to work through their anxieties and reassure them that, there are individuals out there that understand them and that are, willing to advocate for them. I think that's really, really important. And I guess that's what led me here, studying special education at Vanderbilt. Really, it all started with my dad.
Cool, thanks. No questions yet. If that's the case, I'll just have one more for you. And could you just tell us a little bit about the Best Buddies organization at Vanderbilt?
Yeah, so Best Buddies is an organization here at Vanderbilt. Within Vanderbilt, I'll back up a bit. There is the Next Steps program for individuals with developmental and intellectual disabilities. They're basically able to go through an adaptive sort of college curriculum where they'll graduate and receive a certification. And throughout their time in the Next Steps program, they have access to a variety of clubs on campus, one of which being Best Buddies, where individuals with intellectual and neurodevelopmental disabilities, they are linked with college kids around campus. And basically you form a really close knit friendship with whoever your assigned buddy is. You guys go out, you guys talk on the phone. Sometimes you guys gossip about things. It's really just any average college friendship. We're pretty much all the same age. A lot of times we're matched up on interests we have or things that we like to do. So yeah. Oh, I love the cat. But Best Buddies is an awesome organization. And again, individuals on campus are partnered up with individuals with disabilities.
Awesome, thanks. I got one more for you because we got one more minute. Why do you think it matters for folks with disabilities to reach out to their legislators?
Yeah, that's super, super important. We as advocates, so a lot of us are neurotypical, we're able-bodied and everything, and we can really try our best to understand the needs of individuals with disabilities. Sometimes we live with them, we're around them all the time, we see them, but it's really, really important for individuals with disabilities themselves, if they can, to advocate for themselves, because only they truly know exactly what is needed for them, what is needed for their happiness, what makes them happy, what they're comfortable with. So yeah, I would say that advocates, it's really, really important to reach out to your legislators, especially you just have a really, really powerful voice. All of this is for you guys, that we're all here for you. These programs are for you. So we definitely need to hear your voices and your opinions and your cries, and legislators do as well. That's the only way we'll be able to see change.
I agree. That's a fantastic answer. Agree 100%. Thank you, Elijah. This was excellent. Thanks for answering our questions, showing us the General Assembly website. Much appreciated. Thank you.
Yes, thank you again for having me.
And with that, I'd like to hand it over to Sarah to introduce our next speaker.
Hello, I am Sarah Scott. I am a white woman with long dark hair in a ponytail and glasses. And I am pleased to introduce Cecil Williams. He is a Chattanooga native, and he serves on the Mayor's Council on Disability as program chair. Cecil is also an adaptive athlete and volunteers with Spark of Chattanooga. Cecil is part of the Kyle Peace Foundation Tri-Team and serves on the athlete committee in Atlanta, Georgia. He says the turning point in his life happened in 2018 when he started his blog, The Adventures of Cecil. He is an aspiring professional speaker and inspirational writer, and we're excited to have him here tonight. Take it away, Cecil.
All right. How's everyone doing? Thank you so much, Sarah, for having me. Thank you for that warm introduction. I'm a young Black man with a college sports hat on, and one of my favorite t-shirts. I have good teeth and a fridge mouth. Tonight we're talking about advocacy, and I looked up that word, and what that word means is supporting a call or a bill. It's something that you want to support. And long story short, I became disabled. Over the years, I had a car wreck May 9, 2003. So in 2004, that's when they found the ataxia. It affects your nerve, your speech, your coordination, your balance. So it just progressed over the years. So until 2008, that I've had to file for disability. So I've experienced life as being able-bodied and disabled, permanently disabled. So being disabled, I've seen a lot more that I have to go through, that other people have to go through. And I realized the importance of this, work. Like the young man said, we deal with anxiety, it's COVID going on, and we need someone to advocate for us. So in 2018, I started my blog, The Adventures of Cecil, when I found adaptive sports. I've done kayaking, adaptive snow skiing, racing. I love racing. Adaptive scuba diving, you name it. I've done it. I've tried it. I love the thrill of living on the edge. There are different programs out here, and you have to utilize the power of networking and social media. Let me say it again, use the power of networking and social media. And also emailing. So if you have a question about something or not for sure, always reach out to someone. And my path right now for so much for the adventures of Cecil with that, I like to spread the awareness of disability, people with disability. You know, I want to dispel that myth that we can't do anything. You know, that's when inclusion comes into play. That's why I drive 2 hours to Georgia to race with the Cow Peace Foundation. I'm pretty good at it. I used to become a bike, and that's what I love. And I want other people to know that, hey, you can do this too. So it's not all about me. It's about sharing what you know with others. Each one teach one. And I want to reiterate, use your voice because your voice does matter. Thank you.
Thanks so much, Cecil. We will have time for questions if folks want to type that in the Q&A. Clancy asks, Cecil, what is your favorite sport to participate in?
Right now, I like racing. That gives me the greatest feeling in the world. It's a catch track where you sit on a recumbent bike and you use your feet and pedal outside. Now, these are road races. Like I actually had the privilege of doing Petrie in person last year. So that's what I love to do right now.
Cool. Another question. What are some of the things that you do on the Mayor's Council on Disability?
Some of the things that I do, first I want to clarify why I joined. I want to make a change. There are a lot of people that complain, but I feel like I know a little bit and that I can add value to the Mayor's Council. Now, what I do is I do the social media page for the Mayor's Council on Disability. I help with the programming aspects of it, like different events that come up, ADA celebration, reaching out to our different partners to kick off events.
Cool. And I believe I've heard that you also have provide some advice on how to make programs more inclusive. Is that correct?
Yes, ma'am. I do. I do provide advice. I'm on the athlete committee and for the Cow Peace Foundation for and do it. And plus, I'm bringing it here in Chattanooga as well. We're trying to make a big push to make races in Chattanooga more inclusive for people with disabilities.
Very cool. And how do you feel confident and how do you prepare to do those things on the Mayor's Council?
Yeah. I'm just me. I know that sounds simple. I'm sure I'm just me. I take what I've learned over the years. And I've been doing adaptive sports since 2018. So I've been Vermont, Georgia, North Carolina, different places to learn how these things work. So it takes a village. And the Men's Council, I'm just one person. I'm there to help build what we have and what we look forward to having in the future for the disability community.
Well, it sounds like you do an awesome job. I'm glad you sit on that position. We have one final question for you. Is the council made up mostly of people who have disabilities themselves?
Well, I will say we have a few people with disabilities. So I'm glad I am one. So I think that's a quote by Michael D. Fox. The people who are living with the disabilities are the ones who are the experts.
Beautiful, beautiful way to end. Thank you very much, Cecil. And with that, I'll ask Sarah Scott to transition to our next speaker. Thanks again, Cecil.
Next up, we have the lovely Courtney Johnson. Courtney is a 24-year-old autistic adult with multiple disabilities, including traumatic brain injury, Ehlers-Danlos syndrome, and other conditions. She is a graduate of the Partners in Policy Making program, and she has presented at various workshops and conferences and panels around all over the place. She also established her university's very first student-led group for students with intellectual, developmental, and cognitive disabilities. Welcome, Courtney. Take it away.
Hi, everyone. My name is Courtney. Thanks for having me here. For a visual description, I am a young white person with blonde hair and wearing black rimmed glasses, a red shirt that says Celebrate Different, a black cardigan, and a headset. I'm sitting in my wheelchair, and you can see some colorful sensory tools nearby. I'd like to reassure you all before I start that I am indeed a person and not a telemarketer. I promise I won't ask about your car's extended warranty while I'm here. What you hear is called an AAC device, short for Augmentative and Alternative Communication. You might see my cat around in the background, but that's okay, since she helps with my advocacy work anyway. If the cat jumps in, she is a tabby cat with green eyes and is just a little bit chunky. Like Sarah said, I'm an autistic adult with multiple disabilities. Prior to the pandemic, a lot of my advocacy was focused in person. I've run vigils for the Disability Day of Mourning, founded and ran the Neurodiversity Club at ETSU when I was attending, organized panels and presentations, been to Washington, D.C., and more. However, in-person events aren't exactly the safest option right now for a lot of us. I'm still in medical withdrawal until my doctors say it's safe to return to classes. Due to being immunocompromised and chronically ill during a pandemic, a lot of my advocacy work is done online these days. It can sound strange, but online advocacy can be incredibly effective, especially if done well. One of the keys to effective virtual advocacy is community. For me, I've done this in a variety of ways. I've used social media, Facebook groups and virtual social groups, and done online presentations. I've also written posts and articles, op-eds, and emails to government officials, In all of these things, my focus is the disability community in some way or another. When I write op-eds or send emails to government officials, I make sure to intertwine both personal experiences of my own story and also the disability community as a whole. On social media, especially Instagram, I've learned to utilize it as a way to share resources I find or create with other people with disabilities and their families. I make posts sharing my story as a disabled autistic adult who uses an AAC device to communicate and has caregivers to live as independently as possible. A lot of people have never seen people like me before, so it creates a lot of opportunities for conversations that never would have happened otherwise. Sometimes simply sharing your story can be an act of advocacy in itself. I also share things like calls to action for bills, petitions, and other things that the community might need to be aware of. In using a more personal approach, I'm also involved in a few smaller groups individually. For example, I'm an AAC mentor in Tennessee's Out and About group, where other AAC users meet together to make friends and improve our communication skills. We've been meeting virtually right now through Zoom, and getting to see the kids' faces when they meet another person who uses AAC is absolutely wonderful. One of my caregivers and I have also started up a disability coffee chat, where people with disabilities meet virtually once a month on Google Meet and just simply hang out. With the pandemic, a lot of us are still in lockdown, and we wanted a way to socialize safely. All of this said, making these connections can be incredibly important in disability advocacy. Sometimes the people you meet can make the difference in connecting to supports, finding resources or grants, and programs that can be life-changing for people with disabilities. And sometimes, you might know something that could be helpful for someone else. Advocacy, even on the smallest scale, can make a major impact in ways you might not ever see. When I approach advocacy from a virtual standpoint, there's something I try to always be mindful of and emphasize as much as I can. And that is the necessity of intersectionality. It's very easy to forget that when you interact with others online, there's someone else on the other side of that screen. The concept of anonymity, when you don't really know who the other person is, can make it harder to remember that each individual you interact with is a human being, someone who has a variety of experiences, thoughts, and sometimes very different circumstances from you. The internet allows you to communicate with people from a vast array of places, cultures, and so much more. And so when you are doing advocacy online, especially disability advocacy work, it's incredibly important to focus on the humanity of each person you might encounter or meet, and the intersections of the communities they live in. People don't always experience life the same way. People with disabilities face different barriers, and the same is true for other marginalized groups. And when someone is a part of more than one of those groups, those barriers become even more complicated. And when it comes to advocacy, we have to be mindful of where others are coming from. We might not always get it right, but it's a learning process. Overall, it's all about inclusion and communication. Like this year's theme, it takes teamwork. Advocacy always is.
Fabulous. Thank you, Courtney. And we will have a couple minutes for questions if folks want to type those in the Q&A. To get us started, we have one. Can you share what a example of a challenge in advocating for a service you need has been, Courtney?
Well, we had to fight to get my communication device.
And how, I see you have it.
Mhm.
What brought you success?
A lot of teamwork with my doctors, my speech therapist, my support coordinator, and reaching out to people in my online community who had similar experiences who calmed me down.
Thank you for sharing. We had another question, and feel free if you're not.
And my caregiver who made phone calls.
Excellent, very important. I'm sorry to cut you off. So a question about your AAC device. If you're not comfortable answering, that's fine. Question was, how old were you when you first started using the AAC device? And what was it that helped you make the decision to use it?
I was in college when I started using it. I originally was a part-time AAC user after a suggestion from my speech therapist and some other autistic friends. It helped dramatically with social situations and with decreasing meltdowns. I use it essentially full-time now, though, due to aphasia from my traumatic brain injuries.
Thank you. We are out of time. So unfortunately, we had more questions. I will get them to you via email, if that's all right, after the event, and we will post the answers. And with that, we'll turn it back over to Jeff to close us out.
Sounds great. Thanks, Sarah. And thank you, Courtney. And all our other presenters today. Everybody was awesome, as usual. Thank you again for being here with us today. So really quick, I just want to recap what we went over today. You'll be able to find some supplementary materials that kind of go along with this presentation, including a recording of the presentation and a transcript at tndisability.org. Our goal today, which I forgot to say at the beginning, but hopefully this applies to you, is to help be confident in advocacy, be that everyday advocacy, asking for what you need in your job or healthcare, or advocacy for a big change like a new law. So hopefully our wonderful presenters helped you get a little bit closer to that goal today. We talked about the top 5 disability public policy priorities, researching your issues using the General Assembly website, engaging in local community politics and councils and how to get involved, and how to tell your story and use social media to get the services that you need. So just a quick recap on DDH this year. This is kind of the kickoff here. It's going to be going through our Disability Advocacy Day over at tndisability.org, our website. I want to thank everybody who RSVP'd. You can check back with us for more updates on your teams, and then we'll be reaching out for folks, helping them set up a small group meeting with state legislatures. Make sure to join a local Facebook group of advocates just like yourselves. March 11th, Disability Advocacy Day. We're going to be lighting up the state blue. We'll be wearing our Coalition Blue and Teamwork Tennessee t-shirts. And for information straight to your phone in your pocket, text Teamwork, capital T, capital W, to 72690. And that'll help you follow along with our Disability Day on the Hill 2022 events. Message and data rates may apply. You probably get 1 to 4 messages per week. Thank you to everybody for joining us. I hope you learned a lot. Thank you to our panelists for joining us and sharing all of your great insights. And I hope everybody has a wonderful evening. Thank you.